because your health is important. We are so glad to have you here this evening. Thank you so much for joining us on Ask Dr. MJ. Why? Because your health is important. This is an opportunity for us to have an interactive healthcare forum. It allows you to call in, tune in, and ask your healthcare questions. So we want to make sure that we are doing what the people want to do. We're going to talk about what you want to talk about. Remember, this is the People's Show. I'm going to introduce a topic. We're going to talk about, if you listen to my Wellness Wednesday this morning on the Rickey Smiley Morning Show, we're going to talk about this new, supposedly new, oral version of semaglutide, GLP-1s, Ozempic, tirzepatide is Mounjaro, but it's basically still talking about GLP-1s. So those are the weight loss products that are available, and those weight loss products are very effective as injectables. The pill format is not new. There is a pill that is available, has been available for years. It is called Rybelsus. The Rybelsus pill is semaglutide. The indication for the Rybelsus, just as the indication for the Ozempic, is for people with diabetes. Lowers your blood sugar, lowers your A1C. The weight loss is a side effect, technically. Well, because of the effectiveness of the weight loss, the companies developed Wegovy and Zepbound. Wegovy is the exact same formulation manufactured by the exact same company. It goes down the assembly line. It goes to the left is Ozempic. It goes to the right is Wegovy. Wegovy has the indication for weight loss only. So you don't have to be a diabetic to get it. So that company is now applying to have the Rybelsus get a weight loss only indication at, amazingly enough, a higher dose to the current dosing. The current dosing is 7 milligrams. It's 3 milligrams, 7 milligrams, titrating up to a maintenance dose of 14 milligrams. This is an oral tablet that you take in the morning. You take on an empty stomach. So you have to wake up. You take the pill on an empty stomach with no more than 4 ounces of water. Now, this is tradition. Dr. Collier tells you to take your medicine with a full glass of water for whatever reason. This is limited to 4 ounces of water. So people do that, and they take the medication. It lowers the blood sugar. It lowers A1C. It makes you lose weight. So with the new higher dose version, the weight loss is going to be what it's focused on, because we have found that the weight loss benefit is absolutely incredible. It helps improve your kidney function. It helps prevent heart attacks and strokes. That was just a study showed that was released this week or late last week that talked about the decrease in cancer risk. I think it may have been 20 or 30% decrease in the risk of all cancers by taking these products, but really it's by losing the weight. But by any means necessary, going Malcolm X, it doesn't matter. You lose the weight, you get healthier. So for people that for whatever reason just do not want to take shots, and I have people that I'll tell them, I say, look, you don't feel the needle. The needle is so tiny, it's thinner than a human hair. You won't feel it. You need to make sure that you're pressing it firmly against, in the auto injectors, you're pressing it firmly against the skin so that you don't waste the dose. But there are just people that they can't get past the idea that it is a needle, so they don't take it or don't take it appropriately. So an oral version as an option is definitely significant and will have some benefits for those individuals. That will also make it much easier to get. Not having to get a shot, you can just get it at once it's in the pharmacies, at any local pharmacy. I'm 100% sure there will be internet versions available as well. And so people will be able to capture this, and we will have more people who are weighing less. So, instead of an obesity epidemic, now we're going to have people being slim and sexy. So that's where you want to be. Now, another topic I want to share with you. There are now pirated websites that are on the internet that are selling products that they are calling Lipodrops. Okay, the only place to get Lipodrops are at the Lipodrops.com official website. You go to the website, Lipodrops.com, and you'll see my picture. You'll know you're on the right top. This is what the Lipodrops, the original bottle looks like, the box rather. The bottle, I'm going to open it up and show it to you. Looks like this. It's a very unique packaging. This is the original Lipodrops Max formula. So this works. This is wonderful. And this is what you should be getting if you're going to one of the pirated sites. And there are at least 3 pirated versions that are available now. Put them up for me, Heilig, so we can let the people see what the fake shops is. Okay, fake lipo drops. Okay, this is one that's coming, I think we think out of China, but if you Google lipo drops, this is the first thing that comes up. If you just Google lipo drops, these are not our lipo drops. These are just like they've literally stolen the name, everything else. So we don't even know what's in it, but people are confusing the 2 products and thinking that this is our product, and it is not. This is another one, Lipo Max, and I think this is available on Amazon. And so it's on the Amazon website, it's on the Walmart website, but the only place to get the original Lipo drops is at lipodrops.com. Like we used to say, www.lipodrops.com. This is the original formulation. We have the Lipodrops Maximum formulation. The bottles pretty much look the same. The logo that's on there, the swirly twirly with multicolors, is a unique logo, and it is patented. So you need to, and you want to get the product that works. You want to get the product that you're familiar with. And because of the success of this product, we have pirates that are out there, and they are paying Google an advertising fee that allows them to go above the original lipo drop. So when you Google it, that's what comes up. That is not us. So please, please, please. I'm getting phone calls from people saying they got the product or they're waiting for the product, and it's not our product. They're not on our site. Our only site, the only place that you can get the Lipodrops Max is at lipodrops.com, the official website. However, the other product line, nobody seems to be pirating that as of yet. They are doing the lipo drops, but our lipo hers, our lipo nights are still unique formulations. But if you go to their website, you won't find those products. So you'll also know from that perspective that you're not on the correct site. So don't Google Dr. Collier's drops. That will take you to a pirate site, which is incredible. They have stolen Dr. Collier's name as well, pirated it and used it inappropriately. So you have to go to lipodrops.com, the original and the only site that you can get the original lipo drops, the Lipodrops Max, and everything else is in our lipo line. That includes the lipo cleanse, the probiotic. If you don't see this picture, you know you're not on the right site, and this is where we want you to go. So this is where, again, success gets you. People, doing well, posting pictures and showing their weight loss. And so people are saying, hey, we can come up and cause that as well. So our other products, again, the Lipo Nights, the Doctor's Menopausal Support, the Lipo Hers, the Lipo Tea, all of these products that are a full line to optimize your health. And we want to make sure that you are doing that. And if you have gotten the products, Lipo Glucose, one of our newer products, if you use the products, please post about it. Let people know the success that you had, and make sure that you say it is the original lipo products, because people are, like I said, they're getting the fake products and they're getting fake results. And so we want to make sure that there's no confusion in the community about which product they should be getting, which products work, and the types of success that you can have with them. So that is the story. That is where we are with that. Thank you so much for your time and attention. Holly, let's do our roll call. See who's on. We have Linda Bloomer from Birmingham, Alabama. Hello, Linda, and hello, Dr. Kite. Thank you so much, Linda. Thank you for joining us. She's on YouTube. Cindy Hill, good evening from Fort Worth, Texas. Thank you for being here once again, Cindy. We appreciate you as well. Deborah Davis, Wissett from North Carolina. Deborah, thanks. She's on YouTube as well. Thank you. Etricia Reese from Austell, Georgia. Hi, Etricia. Thank you for joining us this evening. You're close to the practice. Desi Williams, greetings from San Antonio, Texas. Thank you, Desi. Also on YouTube. Carlos Ward, good evening from Douglasville. Carlos, thank you for joining us, sir. You are a good friend, and we're glad to have you participate. Glenda Everett from Warner Robins. Hi, Miss Glenda. We appreciate you and all the friends and family. Sean Big Time Green, my main man from Monroe, Louisiana. Sean, you got to watch that special that came out today on Netflix about Katrina. This is the anniversary, and they got some good stuff out there. Go check it out. Flight 2.0 from South Carolina. How you doing? Miss Makiba Boland, thank you for joining us. Thank you for being here this evening as well. Lynn F. from St. Louis. Hi, Lynn. Thank you for joining us from the Midwest. Kashawn Garman, thank you for your service, Kashawn. Simplify, my friend. Hoorah, Devil Dog. Mimi Witcher, good evening, madam. How are you? Soon to be visiting Tampa to do a presentation for Miss Witcher's nonprofit that emphasizes childhood obesity. We're going to tell you about that next week. Anna Harris, greetings from Richmond, Texas. Thank you, Anna. Lorraine Daniels, good evening from Maryland. Thank you, Lorraine. We appreciate you for tuning in as well. Okay, Brandon Graham from Savannah, Georgia. Brandon, that name doesn't sound familiar. Is this your first time tuning in from Savannah? We'd like to know. Jesse Jones. Hey, Jesse, you're back. Jesse Bessemer. We appreciate that. Northfield Patrick, Montgomery, Alabama. Roll Tide. There we go. Cynthia Bird, Charlotte, North Carolina. All right. I hope that Alabama has a good season. Kim R, NC. Hey, how you doing, Kim? Thank you so much for being here. Ashley Robinson from Woodville, Mississippi. Thank you very much. Cassandra Miller from Norfolk, Virginia. Hi, Cassandra. I love Norfolk, one of my favorite cities. Tanya Lucky from St. Louis. STL now on Atlanta. All right. Bridget F. from Jacksonville, Florida. Duval. Thank you, Bridget, for joining us. Sonia C. 1965 from Woodstock, Georgia. Hi, Sonia. Shauna Price from joining us from H-Town. Thank you so much, Shauna. We appreciate you. Kaya Avery from Columbus, Georgia. Hey, Kaya, like Kaya. It's pronounced like that. Okay, it's the People Show. It's time to get to your questions. We want to make sure that we're here to answer your healthcare questions. Because if you have a question, there are hundreds and thousands of other people that have that same question. So tell your friends to tune in. This is the opportunity to capture healthcare information at absolutely no cost. You can establish a relationship with us. We are happy to help you through your healthcare journey because we know without question that culturally sensitive healthcare is so important as far as outcomes are concerned. So let's do this. Okay, Sylvia Jones. What can I take for brain fog and headaches every day? 60 years old. I don't feel like myself anymore. Sylvia, if you're having daily headaches, that's an indication that something's quite not right. For brain fog proper, we like our sea moss as well as our lipo shrooms, both available at the official website, lipodrops.com. Both help with short-term memory, long-term memory, brain function, so you're sharp and alert versus having to overthink things or think things through or say, wait a minute, it'll come to me. So those are two products that are natural that I highly recommend. But daily headaches is not normal under any circumstances. Sometimes it's something as simple as needing to get new eyeglasses because all of us are on computer monitors all day, every day. Our cell phones, we're squinting, we're crunching, we're trying to make it work. And the problem is that as we age, our focal point changes and we don't adjust our eyes. So some people never had a real eye exam. Others haven't had one for 5 years, 10 years, at which point your eyes have changed. And so you need to have that. That would be my first consideration. I say go to anywhere that does eye exams. Most Walmarts have eye centers in them now, but there are many eye places around that can do that. And some of them include the eye exam with new glasses. If you buy the glasses, you get the eye exam for free. So that's one of the things I recommend. If that is not the case, then you need to be seen by your primary care physician. Rule out things like diabetes, things like high blood pressure that can give you headaches. Diabetes, as your blood sugar goes up and down, your brain, which is like a sponge, shrinks and swells. When it shrinks, it pulls away from the inner lining of the skull, and that is uncomfortable and causes headaches. And when it swells, it pushes and increases pressure by pushing on, because the skull won't move. It doesn't stretch, it doesn't move. So if the brain starts to swell inside of the skull, you get headaches as well. Could be something as simple as sinus, but the point being, you do not need to suffer. You're having headaches every day. You're 60 years old. Beautiful picture there. You got too much life ahead of you and too many things you could be doing besides dealing with headaches. So going to make the commitment. You're going to go and be evaluated. A comprehensive physical examination, checking your blood sugar, checking your blood pressure, cholesterol, all those things. Get an eye exam as well. And then if those things do not pan out, if that's not the problem, they do not find an etiology of your headaches, then you need to be seen by a neurologist specialist to see what's going on. Okay, Sylvia, great question. Cindy Hill, my granddaughter has an orange spot on the bottom of her foot. Should I be concerned? She's always buying stuff online, putting it in her body. An orange spot on the bottom of her foot is probably something that she stepped on. If it was something she took internally, it shouldn't just be in her foot. And the foot, the furthest part of it away from the body, would probably be the last place it would go. I would look for something in the palms of the hands. But I would say, some kind of orange color permanent marker that could be, could have stepped on, drew on her foot or whatever, and it just takes a while for it to go away. If it doesn't seem to be bothering her, it doesn't hurt, she's not complaining, she's walking okay, her gait has not changed, then, if it hasn't cleared up in a few weeks, it takes the skin about 2 weeks to turn over. particularly if she's washing her foot. So after about 2 weeks, if it's in the skin, on the skin, it should be gone. If nothing else, it should be significantly clearing up, and you see progress as far as it's clearing up. If that is not the situation, then you have it evaluated. If she's complaining that it hurts or there's some problem, if there's a change in her gait, then she needs to be evaluated. So, but other than that, I think it sounds like it's something relatively benign. Okay, Cindy, great question. Tanya, look, hey, doc, what do you think of injections of vitamins? Vitamins are good by injection, but you can get most vitamins are tolerated well and absorbed well just taking them orally. A sublingual vitamin, one that goes under your tongue that's in a melt formation. I know there are chewable ones you can just put under your tongue. That is literally as effective as taking a shot. That's one of the things that I tell my patients about B12 in particular. You can get B12 drops, squirt them under your tongue, hold them under your tongue for a couple of minutes, and that is literally as effective as taking a B12 injection. So, but there are nowadays some creative compounded vitamin products that people either take by injection or by infusion. But that is, that's a decent way of getting it, but it's a going around the mulberry bush to get what you can get by just either swallowing it or putting it under your tongue. And so there are vitamin preparations that are made specifically to go sublingual. There are other ones that are chewable, and you can just chew one and keep it under your tongue. That will be absorbed as efficiently as well. Great question, Tanya. You see me 223. I love that. Hey, doc, my friend has sores on his leg that will not heal. Please advise. Your friend has peripheral vascular disease and or venous stasis. That's poor circulation. Could also have diabetes or a combination of those, all three of those things. So that needs to be evaluated. I would get, again, a basic comprehensive physical examination. Most doctors can check your blood sugar immediately in their office and tell you within 30 seconds to a minute what your blood sugar level is. If the patient is diabetic, the diabetes is definitely not controlled. It could have already done damage to his peripheral vasculature. His peripheral circulation is compromised by the disease state of diabetes, which does do damage to your arteries on a cellular level, which is why people with diabetes end up getting vascular compromise and amputations of the toes, then half the foot, then below the knee, then above the knee amputations. So that is an indication that something is definitely not right. Those sores can get bad infections in them. And usually smell horrible. So this is something that he probably has been dilly-dallying with for a while and now needs to be evaluated by a professional. Wound healing centers can get those healed up. If not, he might need to have even a stent or some procedure in his legs to improve the circulation. But again, that can be cultures that can be done to see if it's just a resistant bacteria. And that's why the wounds aren't healing. But there are several things that can be done, but the longer they aren't healed, the more difficult they become to heal. So there should be a sense of urgency, not emergency, unless you got a foul smell coming from them. Then that makes it emergent. If they are just open wounds and just not healing, then that makes it urgent. And so there's time to make a reasonable length appointment with the primary care provider that can evaluate you. And or a good person also for this would be your friendly neighborhood podiatrist. Podiatrists specialize in lesions of the lower limb. That's from basically the hips down. They focus on the feet, but they do peripheral vascular disease and things like that, so it should not be a problem. Okay, great question. Norris Fitzpatrick, what causes gout on my right big toe every 3 months? Norris, gout usually affects the predominant toe. If you're right-handed, your right foot, left-handed, your left foot, because that toe it takes the first step and usually takes the last step, so it has more mileage on it. That first step pushing off is more damaging. Once you are in motion, it's a smooth transition of weight from one foot to the other, but that predisposes that foot to a gout attack, and it's usually right at the joint where a bunion would be of the big toe. That is the most common area. But I had a patient in the office today. His gout affects his knee predominantly, and when he has a gout flare up, he can't walk. His knee hurts so bad. So that is a problem. But there are medications that you can take that will lower the uric acid level and stop you from having gout attacks. Gout, uric acid crystals, they form crystals in the blood, and it's like literally having little pieces of glass. those little pieces of glass can get stuck in the joint space, and it's literally like you're walking on glass, or pins and needles, or somebody's jabbing you with a knife. It can be excruciatingly painful. Medications that lower the level of uric acid. There are also, sometimes you have to have an injection directly into the joint. An injection melts the crystals instantly, so it's instant relief. The injection itself is no fun because it's already sore and tender and hurting. You stick a needle in there, it's going to be a problem. But there are medications, allopurinol for chronic gout, for Boxostat or Uloric for chronic gout, which I think is probably the best product available. And then for an acute gout attack, colchicine. Colchicine works very well. You just have to take it. You take 2 pills immediately, 1 pill an hour later, and then the day after that. So you take 3 pills in the first hour of the first day. After that, 1 pill a day for about a week, and that you usually get relief by the second day of that. You could get it within hours, but you almost always invariably will get relief by the second day. But then you take the allopurinol or the Uloric to keep the levels down. Colchicine is not the first choice for maintenance of gout symptoms, but it's for an acute gout attack, it is the drug of choice. So if those 3 things those 3 medications are not in your vocabulary, you're not being treated appropriately. So again, either one of those could be treated by 90% of primary care doctors, and every podiatrist could deal with that. So those are doctors you need to get to know. If you're a doctor, some people, they have this condition, it's been diagnosed years ago. They go to the doctor and never even mention it unless they're having an acute attack. And so I've seen patients say, well, I've had gout for years. They never told me about it. And so, I'll ask if there's some history of chronic disease that you have. And nobody wants to claim a chronic disease, so they'll deny it or they'll just fail to mention it. But when that gout attack hurts, when it happens, I mean, you will do whatever it takes to get relief from that because it can be excruciatingly painful. I have been told it is as uncomfortable as childbirth. I've never had a baby. I have nothing to compare. I've also never had a gout attack, but I've seen people have them coming to my office. They can't walk. They're in wheelchairs. It's just amazing how unpleasant that can be. And I have given people injections in the foot and given them immediate relief. They come in, pain at 10 plus level, and 30 seconds after I see them, it's down to 0. So that is the whole spectrum of the treatment of gout. Gout can be associated with certain foods in your diet. It always happens around holidays when people grill food. It doesn't matter what the food is. It's the grilling for whatever reason that seems to make you have a gout attack. And so whether it's chicken, fish, pork ribs, beef ribs, doesn't matter. It's just the fact that the food has been grilled. So we got Labor Day coming up. Everybody's going to be cooking out. So since that's Monday, the day after Labor Day, I'll be getting calls and people wanting to come in because they're having gout attacks. It literally happens every holiday where we're cooking out. Great question, Norris. Cecilia, can you talk about goiters? Of course I can. Goiters are enlarged. The thyroid here is nothing but a gland, and it's made up of lobules, and those lobules can grow or overgrow, and you can get a thyroid goiter. And, when I was growing up, you'd see people with a football under the neck. That's highly rare now because you can put people on medications that can control that. Sometimes it becomes a surgical problem. A goiter can be associated with hyperthyroidism because you got a big thyroid, you're getting excess thyroid hormones, or it can be associated with hypothyroidism, low thyroid, because the goiter is pushing the thyroid tissue to the side, but not functioning. The thyroid tissue is not making thyroid hormone. It's just being compromised and repressed. So you get low functioning thyroid. It can go either way. But for most of the people, thyroid function isn't the real issue. It's the cosmetic effect of having a golf ball, a softball, a football under that neck. And like I said, I haven't seen one in real time in quite a few years, but I just remember growing up in my early medical career, it was not an uncommon phenomenon. You would see people with thyroid goiters. If a person has a goiter, they can be treated medically. They also can be surgically excised. They can take out a part of it. They can take out the entire thyroid. If they do that, then you have to be on thyroid replacement forever. They call it post-surgical hypothyroidism. So you might have had high thyroid or hyperthyroidism. They cut it out. Now you got hypothyroidism, and there's no tissue making thyroid, so you have to replace it with synthetic thyroid hormones. So it can go the full gamut. If it's hyper, there are ways they can give you radioactive iodine to ablate the thyroid, stop it from working, stop it from, depending upon how much you get. The problem is you can't meter that. You can't say, well, I'll get this much and knock out half the thyroid function or 20% of it. You don't know how much of it is going to not be working. So most of the time, the objective is to totally eradicate thyroid function. And then when you do that with radioactive iodine, and it's exactly what it sounds like. It's the iodine is in iodine. And so that is, your thyroid is attracted to iodine, needs iodine, wants iodine. So they attract radioactive particles to the iodine. Thyroid sucks up the iodine, and the radioactive particles kill the thyroid tissue proper. So that is the, the gamut and the spectrum of treatment options that are available. So I hope that answered your question. Okay. Rashana Morrison. Hey, Dr. Collier, what do you suggest as alternative medicine for someone who doesn't have any cartilage in their knees? Alternative medicine would be platelet-rich plasma, PPR, that can be injected. They used to have to get this from places as exotic as umbilical cords of newborn babies. And then this created a big problem with the anti-abortion crowd, because they thought they were aborting babies just to get the platelet-rich plasma from the umbilical cord, regardless of the health or status of the baby. That was not true, but that was the rumor and the scuttlebutt. So they subsequently found out that they can get your own platelet-rich plasma out of your own body, draw blood from you, spin it down, remove the platelet-rich plasma, then separate it from the blood. They can either give you back the blood or throw it away. And then, but the platelet-rich plasma, because it's yours, you can't reject it. It's not going to be an allergic reaction to it, and inject it back into the knee or other joints. I've seen it done in the shoulders, the back, the knee, the neck. What this does, those cells have the ability to become anything. Any organ in the body can be created by these cells. So if you need cartilage in the knee, you put them in the knee. Your body senses that it needs cartilage, and these will make cartilage tissues grow. So this is very effective in a lot of people. Some people get some benefit from it. I've had patients that say they got no benefit from it. So it's, it goes the full gamut as to what benefit you can expect. Most people get at least 3 injections. The biggest problem is those injections are not covered by insurance at present, and they're usually about $1,500 to $1,800 a pop. But again, if you can salvage your knees, a very, very inexpensive alternative to that would be a product that contains glucosamine and chondroitin. Glucosamine and chondroitin are found in various products, but a brand name that I like is Osteo, O-S-T-E-O Biflex. The reason I like it is because it's got good doses of each, and you only have to take 2 pills a day. Some of the products require you to take 4, 6, 8 pills a day. That is a significant pill burden that most people won't continue to do, particularly once it stops hurting. Now, that has been shown without question to repair and recreate tissue in joints like nothing else. Nothing else has ever done that. And that is over the counter. It's not even a prescription. Glucosamine, chondroitin, Osteo Biflex, it works wonderfully. And that is a good natural alternative for that. Other things I suggest, omega-3 fish oil, which kind of oils the joints, because you don't want dry cartilage in there. You want the bones to be able to slip freely and be well lubricated. And that way your joint discomfort becomes less and or minimal. So glucosamine, chondroitin, natural anti-inflammatories such as turmeric, curcumin, the omega-3 fish oil, all excited. And then, the injection of the platelet-rich plasma is also state-of-the-art in reference to that, but has a high cost associated with it. Okay, Rashana, great question. Zandra Harris, good evening. What should we know about integrative cancer solutions? One, there are many options. A person with a cancer diagnosis is looking for something that can help, particularly if you stage 3 or stage 4. So there are integrative cancer solutions. People are going to Arizona. I had a patient that was going to Arizona and getting wrapped in seaweed at a very high cost. He had the money. but I just really couldn't see how that would possibly help his cancer. But there are people that swear it's the greatest thing ever. So you have to do your own research. You need a cancer advocate. And there are places now like the Cancer Treatment Centers of America, the Winship Cancer Center at Emory University here in Atlanta, where integrative cancer solutions are a part of your treatment process. So you get an entire team of people, traditional medical doctors, oncologists, you get psychologists, psychiatrists, a spiritual guide, chaplain, and then an integrative specialist as well. So I'll always say I'm a big proponent of integrative treatment options, but those are what I recommend is those are in addition to, not instead of. You don't say, I'm not going to take the traditional therapy, which may be radiation chemotherapy. But now with some of the newer biologic treatment options that are literally smart bombs in the treatment of cancer, that would be my first option. I would like to have that. And then anything that's integrative, I could add to it. There's no contraindication to doing both, but it's not either or. But I've seen patients that have ignored traditional medicine and decided to do integrative cancer solutions. And then when they didn't get benefit, it's too late. Now they have waited too long. The cancer has spread. It has gotten out of control when they could have at minimum had some benefit by debulking the cancer tumor, decreasing the cancer burden, enhancing quality of life, adding, 6 months, a year, 2 years of their life, or totally curing the cancer. That does happen. There are people that are cancer free using the traditional methodologies. But these new biologics are absolutely incredible. I've been talking about them for 5 years, and now they are literally readily available and people can get them, but you have to ask for it in some circumstance. The doctors don't want you to use it. They want you to use traditional methods, which is what these big cancer centers do. They're set up to give you infusions. They're set up to give you radiation. They're set up to do the traditional things. Not that that is a problem, but also you want to know about other options that are available, including integrated cancer solutions. So there you go, Zandra. I think that again is as unbiased an opinion as I can give you. I am an advocate of them, but not in addition to in addition to, not instead of traditional therapies. Brandon Graham, I just ordered the 3 Lipodrops Max. How do we take it? Brandon, you take the Lipodrops Max. The dropper that's in the product pulls up the exact amount. This is a fresh bottle. I don't want to open it, but let me get it in the frame here. Okay, you turn it around this way. Okay, this dropper, when you squeeze it, it sucks up the exact amount every time. So you take the bottle. The bottle is a suspension, so you want to rock it gently. You don't want to shake it vigorously like that and foam it up. You don't want to do that. Just want to rock it gently, about 8 or 10 times. Then you take it, you unscrew it, you suck up 1 dropper full, you squirt it under the tongue, you hold it under the tongue for 2 minutes, then you swallow it. It does nothing in your stomach. But I've had people that have gotten it. The first thing they squirt it under the tongue and then they swallow it immediately. And so they haven't absorbed any of it, so they're not getting the product. It gets in the stomach digests it, 0 benefit. So the benefit of this is to be absorbed under the tongue. It is exactly as if you are getting an injection of the exact same components, which I have in my weight loss center called Lipovite. The Lipovite is an amazing weight loss supplement because it makes your weight loss 90+% fat only. It makes you lose weight and burn fat from places you cannot traditionally exercise away from, like under the chin, across the back, the inner thighs, the outer thighs, floppy back arms. All of those things are affected by the Lipodrops, the maximum strength form, because people were using the original strength, having great success, and saying, well, if a little is good, a lot must be better. So people were writing me, telling me, calling me, saying, I'm using the Lipodrops, I'm using 2 squirts instead of 1. I'm using it 3 times per day, because the original instructions was 1 dropper full under the tongue once a day. Then we found out you could do it before every meal and have better success. And then we found out that you can increase the concentration. So we increased the concentration tenfold and again, much better results with it. And you can literally use it before each meal. So the Lipodrops maximum strength formulation You squirt it on your tongue. You can do it just before you eat. It doesn't have to be 30 minutes. It doesn't have to be an hour. It can be just a few minutes before you eat. I just say keep it in your pocket, keep it readily available, keep it by your dining room table or wherever you sit down to eat. Squirt it on your tongue, hold it under your tongue for 2 minutes, eat your meal, and it will optimize your body's metabolism and the utilization of your food sources as fuel. That way you're burning food as fuel and not absorbing it and storing it as fat. That is the way your body stores the food. It stores it as fat. Fat is broken down for energy. When your body needs energy, it doesn't take no for an answer. It goes to fat cells and gets that energy. It doesn't like that process. It doesn't like that process, but it does it and will do it if you don't feed it the right amounts at the right times, the right intervals. So when I hear people say, I don't eat breakfast, and then that's why they're gaining weight, because they're not breaking the overnight fast that breakfast literally means, breaking the fast. And when you do that, your body, because when you wake up in the morning, your brain needs food, it needs fuel. If you don't feed it, it's going to go to the liver, get glycogen, turn it into glucose. And then when that process starts, it takes about 4 to 5 hours to reset your metabolism. In the meantime, anything you eat is going to be stored as fat. So some simple solutions like that make a difference as to how a person stays thin, maintains a good weight, or loses weight. When they eat, not necessarily what they eat, but when they eat. Most people that are overweight, surprisingly enough, aren't eating a whole lot. A lot of them aren't eating enough. And I'll tell them you need to increase your calorie content. And they say, oh my God, why would I do that? I'm gaining weight. And then they do it, and then they lose weight, and they're in shock and awe. They say, wow, Dr. Collier, you were right. Yes, yes, because there's a science to weight loss. And calorie restriction is not the only way to do it, and that's the way every strip mall diet does. Weight Watchers, Nutrisystem, I'm Too Fat, Weight Be Gone, all of them, they restrict your calories by roughly 500 calories a day, which is 3,500 calories per week, 7 days, which is the amount that's needed to lose 1 pound. That's why they promise you 1 pound a week or 5 pounds a month. And guess what? That formula is scientifically sound and it works 100% of the time. If you do what they tell you to do, exactly the way they tell you to do it, you will lose weight about the same proportion, about 1 pound a week, no more than 5 pounds a month. The problem is once you stop doing it, and my objective is not just to get the weight off of you, but where you're going to be in 6 months, where you're going to be in a year. I want to make sure that you have accomplished the weight loss objective, but also altered your metabolism so you don't regain the weight. And that's one of the magical things about the Lipodrops. People say, well, once I've lost the weight, do I have to keep taking it? No, you can stop, but you also can keep taking it if you like for maintenance purposes. But under those circumstances, I tell people one dose under the tongue a day, usually with breakfast, is probably all you need. You don't have to do it 3 times per day to maintain weight. 3 times per day will optimize weight loss, but once a day will probably just maintain you at a good weight once you've achieved it. But once you've lost weight, your stomach shrinks, you're less hungry, you're eating less. If you maintain that, you will keep the weight off. But if you decide, well, I'm going to challenge it and eat more, and a lot of people celebrate the weight loss by eating more, and next thing you know, they gain weight back. So to answer your question, Brandon, you take it 2 minutes. You squirt it under the tongue, hold it for 2 minutes, then swallow it. That's how you get the benefit. Great question. Vanessa H., my daughter is positive for celiac disease, and they sent us to confirm. Can you explain the procedure of celiac disease in general and its effect on teenagers? Thank you. Well, not just teenagers. Celiac disease is basically your body's having an autoimmune reaction to the proteins in various types of foods, and so the diet is restricted to food products that will not aggravate the celiac disease. The thing is that I think that disease state is overdiagnosed, and this is a good way that when natural can help and work. I think that probiotics are God's gift to this, and that by adding probiotics to the diet, you can alter the response and markedly improve the celiac disease. Most of the time now, most of the providers will immediately put you on a probiotic formulation and tell you to eat yogurt every day to improve your GI health. And because that can literally alter the nature of the cells that line the intestines on a cellular level, make them more healthy, less responsive to various types of allergens, then the celiac disease can improve. The problem is, in the past, we didn't know that, didn't understand it, and basically just want to put people on steroids and restrict that diet to little or nothing or really plain tasteless foods. And so people just, they didn't tolerate that well because it's just, a horrible lifestyle. You can't eat what everybody else is eating. You can't drink what everybody else is drinking. You feel bad regardless. But when you do eat those things that you like, you have, explosive diarrhea. You're not absorbing calories appropriately. You have malabsorption, so you can lose weight. And just, it's just a chronic, sickly, weakly, I don't feel good sort of feeling. So I have found that adding probiotics to this disease state markedly improves the outcome, no matter what other treatments you go. There are biological products now that treat celiac disease and other diseases of the GI tract in an amazing fashion. And those are products, example, Enbrel. Enbrel is a medication that was originally for rheumatoid arthritis, which is an autoimmune disease. They were giving it to people with rheumatoid arthritis that also happened to have some GI issues. And they found out the GI issues were being treated appropriately, going away, improving, whatever. And so now it has an indication for a lot of GI problems as well. So ask about the biological therapies that are available versus just traditional therapies. And also, no matter what, add probiotics to that diet. Okay, great question, Vanessa. Grant 82366 have a question about skin sensitive and lupus. What do you treat with? Okay, skin sensitive and lupus. So skin sensitivity, again, believe it or not, I would use as well the probiotics because that helps alter the body's immune response, and lupus is an autoimmune disease, and so that will help tremendously. The skin sensitivity is very important, what and how you treat the skin. I would use a product like Dove for sensitive skin to shower bathe in warm water, not hot water or even cool necessarily. It can be tepid, meaning that it's not cold, but it's not hot. So it's cool though. It's cool to the skin, to the touch, and it may be cooler than you like your showers, but it is amazing to do that. I wouldn't necessarily soak in a tub because that dries the skin out. So bathing with a Dove for sensitive skin type product, using a body lotion that contains vitamin E. Vitamin E as in epsilon. Vitamin E is an epsilon, very good for skin health. You can also apply even vitamin E oil to the skin to help moisturize it. That decreases the sensitivity as well. So this is a total body problem, and it has to be treated total body wise. And you have to do it continuously. You can't do it for 2 days a week, and when you feel better, stop doing it or become slack with your skin treatment regimen. Very important that you treat that skin because it is one of the largest organs in the body. Not the largest organ, but it's one of the largest. So one of the questions they used to ask on the medical board, what was the largest organ? And people would say, the liver. And it wasn't, it was the skin. But then they found out it's not the skin. It's a system called the endothelial cells that are lining every artery in your body. So far more of that than anything else on your skin. But that's how you would treat that. And then, of course, keep the lupus symptoms under control, which may require occasional bouts of steroids, which are still one of the most effective ways to treat. You just treat it, calm it down, either stay on low dose or come off of the steroids until there's another flare up. But being sensitive that when you get a flare, there are things you can do to prevent it from becoming bad. Because lupus, when it's systemic, affects all your organs, the kidneys, the lungs, all kinds of things to create havoc inside the body on a cellular level. So great question, Grant. We appreciate that. Deborah Davis, your opinion of taking CellCept long term. I have the autoimmune disorder bullous fumagus. Okay, that is milligrams of Precept. Okay, so you're on a complicated treatment regimen with the CellCept and the prednisone. We were just talking about steroid use. That's a low dose of the steroid. Doxycycline comes in 50 or 100 milligrams. Most people take a 100 milligram tablet once a day. So long-term wise, if that's what's controlling it, that's what's controlling it. CellCept added to that treatment option should be giving you some great relief as far as that, because it basically, the bullous fumagus gives you blisters on the skin, your skin blisters, for no apparent reason. You touch it, it blisters, and you can go from head to toe, be one big blister. The blisters break, the skin oozes. It's a horrible existence, so to speak. So the cell sep calms all of that down, gives you great relief from it, and you take it as long as you need to take it. There's no I take it for a short period of time and then come off of it regimen like that. There's no take it for 30 days, take it for 60 days. Most of the time you take it either when it flares up or you stay on it. And if it's working for you, then understand your immune system is compromised when you're doing that, which makes you more susceptible to infections. So you don't need to be around sick people, but you can't be a bubble person either. So you have to challenge your immune system to some exposures. But but somebody that's obviously sick, coughing, hacking, might have pneumonia, might have COVID, might have RSV, something like that. Those are people you need to avoid. And so, and when outside, when in groups, you wear a mask and preferably goggles to keep you at night, because mask prevents it getting your nose and mouth. If somebody coughs in your face, it gets in your eyes every time you blink. It goes down the tear ducts here, goes into your sinuses. It is the perfect inoculum. It is just as if you they just cough right in your mouth. It's exactly the same thing. So you have to protect your eyes as well. Okay, great question, Deborah. That might be the most unique question I have had. I'm glad I was able to talk about it. Shayna Price, can you recommend a supplement for treating fatty liver? I've been trying to lower my high cholesterol and fatty liver. I have promestatic diabetes. I've changed my diet and doing Collier weekly. Okay, diabetes, again, guess what treats fatty liver? The GLP-1s, all of them are getting that indication now. So Ozempic, Mounjaro, not only will control the diabetes, make you lose weight, but will improve the fatty liver or totally convert it back to normal. This is, again, a side benefit that wasn't expected. Nobody noticed it until people with fatty liver got on the products. They lost weight. And guess what? The liver improved. So with that diagnosis, you should be eligible for the medications, and your insurance should cover it. And that should give you great relief from that perspective. And it might be something you have to stay on. But once you have improved the liver, those things that you did to get the fatty liver, eating, processed foods, fried foods, alcohol intake, all of those things, and just being overweight itself, when fat is deposited, it's deposited not just on the skin, under the skin, but inside the internal organs as well, particularly the liver, because that is the body's filter. It filters all of the blood and detoxifies it. Fat cells can get in that blood-rich environment and like it and just start growing. And the next thing you know, the fat cells are pushing aside the liver cells, and the liver is not able to perform its primary function, which is detoxification of the blood. So when that happens, your body becomes toxic. So that is why it's very important to calm that fatty liver down. And one of the most effective things that they have discovered is the GLP-1s, the Ozempics, the Mounjaros work wonderfully to help reverse fatty liver. So talk to your provider about that. If they are unaware of it, go to one that knows how to do this. It's not complicated. It's the same regimen as if you were trying to lose weight. And even if you don't need to lose weight, which is possible, then they still will help. It still will help with the fatty liver because it will remove fat cells. Okay, great question, Shauna. I'm going to take a sip. Okay, Kayla. Can hyperthyroidism, Graves' disease, be treated naturally? Graves' disease is usually an autoimmune phenomenon as well. So you need to calm down your immune system. Things that can do that include the probiotics that we spoke about before. But the methimazole is still the primary treatment. You cannot have high levels of thyroid floating around. It can cause a condition called thyroid storm, which results in heart attacks and strokes. Blood pressure shoots up. At minimum, makes you lose so much weight. You skinny, you look and appear ill, and you're weak because you've lost your muscle mass as well. So the prescription medication is key, and it does work. Thank goodness. It's not complicated. There are no substantive or significant side effects to it. It just lowers it. Sometimes you have to take a higher dose, and in doing so, until the thyroid levels are normalized, you may not feel good. But the bottom line is, and that may be the case, I see you saying you take it every morning and you just may not be at the point where your symptoms are relieved. But hang in there. It can be relieved, and then a low dose may be required for maintenance. But one of the things I'd advocate, again, probiotics. Go to the website, lipodrops.com. Get the lipobiotics. That will be amazingly good for altering your body's immune response. And also our Lipoimmune is a great product for that as well. Not only does that help prevent you from getting respiratory tract infections like the coronavirus, the flu, RSV, but it also helps boost your immune system on the inside as well. And so, because this is an autoimmune problem where your body does not recognize self and it starts making antibodies to thyroid tissues, this irritates and aggravates the thyroid tissue. So the thyroid tissue starts making more thyroid hormone, and it creates a problem because this is your master gland. This creates problems with your metabolism, your temperature control, your heart rate, your blood pressure. All of these things can be impacted by too much thyroid. But by increasing your metabolism, it makes your body catabolize itself. That's why you lose weight, and you lose a lot of weight. Your face gets sunken in, your neck gets skinny. If you're a woman, you can lose your breast tissue. So all of these things can be a big problem. But so that the treatment you already are on, you just have to embrace it. The other is things you can do naturally would be, I would take some omega-3 fish oil. I would take some probiotics as well, and see how that affects you. Now, it's not going to be take one pill and you're better. But after you've been on it for a couple of weeks, you'll notice a difference. After you've been on it for a couple of months, it will have done what it's going to do. It's just a matter of staying on it at that point. Okay, go to the website, lipodrops.com. Margaret Cherry, hi, Miss Cherry, my first time. Are the GLP-1 patches any good? The GLP-1 patches, let's put it this way. I don't think it's as effective as the oral version or the injectables. I think that this is something that is being, because they were concerned about breaking the patent for the injectables, people were trying to come up with a way to get around it. So the GLP patches are not, they don't have a manufacturing standard. People are making them and making them up in a variety of different ways. So it depends on the quality of manufacture, who's manufactured, the standardization of dosing, etc. But that absorbs the GLP-1 through the skin. And, the point is, you can tell almost from the price point that it's probably not as good as the injectables because, they're much less expensive. So are they any good? And then also, people are using the term GLP-1 because everyone knows what that is now. They're familiar with Ozempic. They're familiar with Mounjaro. The term GLP-1 is in their vocabulary. So when people see that, they think that's what they're getting, and they're not getting necessarily semaglutide or tirzepatide. They're getting sometimes nothing like that. There are peptides that can mimic the effect of a GLP-1, and there are combinations of peptides that are very effective in that. And a lot of weight loss centers will use that, but the GLP-1 patches would not be my first choice in doing so. I'd rather go to a reputable provider and get what I actually want to get. And sometimes that may, nowadays, the price, which was $1,500 to $1,800 per month, every product on the market now has a price cap, basically a $4.99, and some of them will allow you to get the first month for $2.99 or $3.99. But all doses of all of them now are no more than $499 cash, which is a lot of money. But still, if you do that for 2 or 3 months, you might be able to get where you want to be, and that would be the best investment you can make into you. This is not the time to go and blow your 401k or anything like that. But most people have at least that much on a credit card they can utilize, and they can get their health status optimized. And then if you have a health savings card as part of your employment, that will cover that. It will cover the real medications, the real GLP-1s. And so that is an option as well. So, Margaret, I wish I had more information about that, or whether I can endorse them. I cannot. I'm not necessarily saying they aren't good, but I'm just not saying I don't know of a product that I would endorse or recommend that is a patch for GLP-1. All right, Ronnie Harvest, Vet's treatment for Peyronie's disease. There are several, Ronnie. They have injections now that you might have seen advertised on television. They use a banana as a prop. Of course, they can't show the real male member. In doing so, Peyronie's disease is where the penis has scar tissue in it, and it curves like a banana. It can go left, right, it can go up, down. But, most of the time, as long as it's working, it's okay. But sometimes the deformity is cosmetically displeasing, or it can impair a person's ability to penetrate a vagina. And for a woman to enjoy being penetrated by a bent hook, so to speak. So those treatments, before then, they would surgically go in and release those scars, and the surgical outcomes vary. Some people did great after them. Some people were permanently scarred, disfigured, or whatever. It was never a guarantee as to how it was going to do. The newer treatments are the injections are, much better outcome. You get the injection, you can't have sex for, I think, 3 or 4 weeks, and then you have to almost have a splint-like apparatus to straighten the penis out. But it has been shown to work. So Google that. If you just Google Peyronie's disease, it'll probably pop up first thing, and look at that as a possible option for you. Okay, Ronnie, good luck. Please keep us informed as to how this comes out. Kimberly Rutherford, do you know if there are any different options available for African American people need to have a kidney transplant? No, unfortunately, because African Americans are the least opt to donate a kidney. There's a shortage of kidneys, but you don't have to get a kidney. A black person does not have to get a kidney from a black person. We are much more alike on a genetic and cellular level than you might think. So race of the donating individual is not as important as the genetic makeup and the compatibility of your genetic structure as far as whether you can accept or reject that kidney, how close a match that it is. I was just reading a story about a gentleman who had been needing a kidney. He met a woman that got married, and finally, for whatever reason, she decided to get checked. She wanted to donate a kidney. He kept saying, no, you couldn't possibly be a match. Finally, after they'd been together for maybe 3 years, she matched, and she was almost a perfect match. So when that happened, she's willing to donate. I don't know whether she's actually donated the kidney at this point, but she wanted to and is willing to. But that was just amazing that he had his blessing and didn't know it. She was his blessing in more than one way. He said, quote, she was the woman of his dreams. He loved her, etc., etc. Then found out she was also a perfect match to donate his kidney. So there are treatment options, including for most donated organs, you cannot necessarily designate a donor. Kidney is one of those things that's kind of unique, though. People can get tested and decide they want to give the kidney to you versus it going into a donation pool and people saying, well, who's next on the list, regardless. And that's the way it is for almost every other organ. But for kidneys, you can have direct transplants. You can say, okay, I match Dr. Collier. I want to give Dr. Collier my kidney, and people do that. And so there's a network of individuals in reference to donating kidneys. I would not try to go out of the country and get a kidney because you don't know where those organs are coming from. There literally is a business of harvesting kidneys from people. You somewhere, somebody drugs you, you wake up in a tub full of ice, your kidney's been taken out. Fortunately, because there's only one, you still got another one, you're okay. But this is a real phenomenon. It does happen. So the options available, I would, get on the internet, do my own search, be your own advocate. Nobody's going to be looking for a kidney like the person that needs a kidney. And they should be savvy enough or have someone that's savvy enough in their network, a relative, a younger person, a niece, a nephew, a grandchild even, that can help them find and increase their opportunity for getting a kidney transplant. Because it's an arduous process. And then you have to be sick enough, but not too sick. And then if you get too sick, you're not eligible for the kidney transplant because you're too sick, and they don't want to waste a good organ on somebody who's probably not going to survive either the procedure or survive too long once they've gotten it. So that is where we are with that. So that will be our last question today. I want to thank Halleck for being our producer and backstage, giving us everything we need to know. I want to remind all of you, go to the official and tell all your friends, go to the official Lipodrops.com website, not one of the fake pirated sites that are utilizing the name Lipodrops that you will find if you Google Dr. Collier, you will come up with some of these bogus sites. You have to go to Lipodrops.com. That's where you get the quality products of choice. Highly put those back up again, please. We want to see the pirated product. This is the fake Lipodrops. This is what was delivered to the office for somebody asking for a refund. Incredible. Okay, that's fake from China. This right here, I think it's from either Walmart or Amazon site. This is not like it says Lipo Max, but remember our product is Lipodrops Max. It's close, but it can fool some people. The original Lipodrops, the blue bottle, the black top, the swirly multicolored insignia on the label. That is it. This is the original Lipodrops of African mango, which in and to itself is uniquely available to save you, to make you lose weight. And then, of course, the Lipodrops Max formula, which we show. Thank you, Holly, for a great show once again. And thank you for tuning in. We know you have options. We hope that you have found this to be a great show for you. And we want you to know. Tune in on Wednesday, 6:30 p.m. Eastern Standard Time for the Ask Dr. MJ Why? Because your health is important. The only interactive forum that allows you, the listener, the caller, to tune in and ask your healthcare questions. So remember, we want you to do that. We want you to listen to Wellness Wednesdays every Wednesday morning at 8:20 Eastern Standard Time on the Rickey Smiley Morning Show, where you get healthcare information for you and the other listeners. Thank you so much once again, Dr. MJ Collier. I am your humble servant, and we'll see you next time.